Unna Health is using AI to support medical coders, helping to identify risks, spot patterns, and make filing and managing claims more simple. Rather than replacing people, their focus is on building AI that works alongside humans inside real workflows. I'm joined by Dave Wellman, the founder of Unna Health, to talk about what it looks like when AI is used as a thinking partner, not just a tool. Dave, thanks so much for being here.
Thank you, Stacy.
So I want to start off, when you were first building Unna, what made you confident that AI could actually do something meaningful for medical coders and not just automate tasks, but actually genuinely help them think better?
So when I started Unna Health, we were actually looking at a more narrow niche with inside of the medical coding community and a problem that they currently have. And when we were getting closer to launching it and we kind of working through the proof of concept, AI just rushed into the marketplace. And we took a step back and looked at that going, you know what, this is really good. This is a whole new way of thinking about how computers work and how people interact with them. And it solves a very difficult problem that we currently had. And that was that medical coders by nature are in it's almost a regulated environment, health, finance, all of that. And there's an enormous amount of documentation. And being able to parse through that documentation with traditional computer methodologies just wasn't working. And AI brought in a new way of looking at that information to be able to help us surface the most relevant pieces of information for those coders to make decisions. And that was a major change for us. It didn't fundamentally change the product direction, it accelerated it. And I think that's what's given us a really good position with inside of the marketplace and a product offering that's so far it's been very well received.
Interesting. And so for what I understand, Unna's AI is constantly scanning patterns in documentation and codes. And so can you give us an example of something that AI catches that a human might easily miss?
Yeah, of course. So if you're looking at, hey, how do I fill out this claim? You're looking at all the different patterns from the provider notes to regulatory rules and guidelines that come from CMS, it comes from WHO, plus you have insurance companies that have their own policies on top of that and providers that have their own expectations. And so you have this massive amount of information that's layered on top of each other, and it's not really well joined. So you could have one insurance companies say, no, you need to submit it this way with these types of codes. And you have another insurance company that says, nope, you have to submit it with those types of codes. And being able to keep that reconciled within your mind when you're supporting possibly hundreds of doctors gets very, very difficult. And so having a computer that can look for those nuances with inside of all those documentations and look for things that might be conflicting or challenging and bringing that to the service of the coder so they can make an informed decision is the key aspect that we're driving towards.
It does sound like a really complex process. How do coders usually react when they see that insight?
So I think that coders have a difficult job, and a lot of people don't. It's kind of this shadow industry, as some have called it, because we know it's there, right? But you never see it when you go see a doctor, and you never see it when you get your bill. It just happens underneath the surface, and this has been going on for a long time. And there's a lot of discussion and talk about what jobs will AI eliminate, and in that list for like the last 2 years, it's always been coders in the top 5. And so a lot of coders are frightened, like, will this take my job away? Will this replace me? I've heard this from coders. I've heard this from practitioners. I've heard this from universities. Like, we need our students to be enabled to be able to enter this new workforce, and we don't know how it's changing. So there's a lot of questions about, we know this is coming. It's coming from a lot of different directions, but we don't really know how to respond to it.
Interesting. And I've heard that a lot too in my conversations with people working in the AI industry. So how do you design a system that feels like a smart assistant and not just telling people what to do so that they feel more enabled, I guess, to do their job?
So it's very easy from a technology standpoint to say, hey, I've come up with a solution that solves this problem. And usually that comes with the attitude of, hey, there's a friction with inside the supply chains, inside of our decision processes, whatever the protocol is. And if we can put AI or any type of software on top of that, we can actually eliminate what they call waste. But when you're looking at it from that standpoint, you're very surface, but you got to get into the deeper substrate of what's really going on and why it's happening. And it's a very naive approach to say a technology completely can solve all these problems. It takes a much more nuanced and thoughtful approach to say, how do we enable this to get more value out of it, to make the jobs of these people easier, to make their results better? Because doctors' livelihoods are on the line. It actually affects patients' outcome and well-being. So the bar is very high to be right. And having the attitude of, oh, we could just build software that does that, ignores that need. And being able to dive down a little bit deeper and understand exactly what people need and what they're afraid of, which is also very important, and how to solve that in a way that makes their success higher is the ultimate goal for us. We want to empower these individuals. We want to make them better coders.
How do you go about doing that? Do you have focus groups? Are you constantly talking to coders? How does that work?
So coding is a really interesting niche environment. And so when I first started getting into it, I was talking to coders, and I had been working with insurance companies and providers on large scales. But I didn't really understand this part of the market. And so I started studying it. I mean, I would watch YouTube videos, I read books, and I got to a point where I realized I don't really know how this works because there's so much to it. So I signed up and I took classes. And so I actually took all the classes to be certified as a medical coder, to understand the process. I did this before AI came on the scene. And I think that gave me a unique foundation to be able to understand how technology works in a classical sense and how we could leverage this new technology that's coming on the scene in the context of this really unique niche environment.
And I would imagine that the people that you work with really appreciate that you have that background and really understand where they're coming from.
It's fun when they actually quiz me to see if I know what I'm doing. They stump me all the time because they know their job better than I ever will. But it's nice to have a common language, and then for them to respond like, "Oh wow, you really taking this seriously. You understand what we're dealing with." And there's a sense of calm that happens after you have that conversation, and then you can get into the problems. And it's no longer I'm coming for your job. I'm coming to help you with your job, and it's a big shift.
Yeah, that is a big shift. Well, as AI gets smarter, what is the next capability that you're most excited to bring to coders that could really change how they work day to day?
So there's kind of the challenge. Let me kind of back up on what happens with coding. Okay, now today the crazy thing about medical coding is it's still very much paper based. And you think, well, medical is probably more advanced than that. But no, they ship books every single year. And it's a stack. I have a stack of 5 books that are 3 to 4 inches thick each. And these books have all of the rules for every single code, for every single diagnosis, for every single procedure, for every single outcome. And being able to combine all those together and sequence them is the hard part of the job. And we're doing a very good job at helping to surface those rules to really make it easier. What I'm excited about as we start to become more of a part of these providers' infrastructures, we call it protocol integration. And the more we get integrated, the more we're able to really focus on what we do really well. There's a temptation to say we can do all of these things. We can handle the entire revenue cycle management line, which is massive. But made the decision, no, we're going to be very narrow. We're going to focus on this one specific problem and do it exceptionally well. And so what I'm looking forward to as we come up with new technologies, new features with inside the system, that we're able to actually pull back the knowledge of these coders and encode it in such a way that the computer actually learns how they operate in their environment, and be able to do that as they change from provider to provider or payer to payer. Payers are insurance companies, providers are doctors, of course. and be able to naturally just adjust as we go.
That sounds like a really exciting future. Is there anything else before we wrap up that I didn't ask you about, or anything else that you'd want to mention about Unna Health?
Yeah, I'm. This is something I'm actually really quite proud of. I'm proud of it from a technical standpoint, of course. There's an enormous amount of work, time, and energy that's gone into it. But I'm really proud of it from the fact that when I hear feedback from our users of, hey, I can't live without this. This is making my job easier. I've heard people refer to Unna as she. It's like, I need to go ask Unna. I need to check with Unna. Make sure you run that past Unna. I've heard these phrases. And so it's almost like it's become more than just a piece of technology. It's actually becoming a partner of their job and their work life. And I can't think of a better use of business and technology to make things better for people.
Well, Dave Wellman, owner of Unna Health, thank you so much for your time. I appreciate it. And you can find more information about Unna Health on their website, unnahealth.com. Thanks, Dave.
Thank you very much.